now we are moving forward for the myopia, which is the second type of your, which is your second type of your refractive error. And please remember, in the myopia, this is known as the short sightedness. Guys, we talked about the long sightedness. I hope you remember why this was there was the focus point was longer than the normal one. And what is happening in this condition, you can see here, this rays which is going parallel to your light rays, after the making the banding or after the making the refraction, it is making the focus point, it is making the focus point here before the retina only. The normal focus point should be on the retina, but this is making the focus point, this is making the focus point just before to the retina, right? So what is this here? The focus point, focus point is before the retina. Yes, and whatever we talked about here, you can see this is the longer than the normal one, or we write it down there. There is the focus point which is the behind the retina. Yes, but what we are talking about here in the myopia, this is before the retina. So you can see if the normally focus point should be going to over here, it is shorter than this. Yes or no? It is shorter than the normal. Am I right? It is shorter than the normal or not? Yes, it is shorter than the normal. So please remember, that's why it is known as your short-sightedness. So write it down here. The focus point, the focus point of myopia is, the focus point of the myopia is shorter than normal one. That's why this is known as your short sightedness. Please remember, that's why this is known as your short sightedness. If I'm talking about the total eye power, please remember the total eye power. The total eye power is increased here. The total eye power is here, increased here, right? So the total eye power will be increased. Yes, as we talked about it, what is our total eye power? Our eye power is what we are having, the our eye power is your your 58 to 58 to yes, 58 to 60. Very good. But what will be happen here? What will be happen here? Yes, this will be your, yes, doctor, this will be going to, this will be going to increase. So it will be going to increase. Yes, it can be 50 more than the 58 or 60, right? And it will be more over it, right? It will be the more over it. So this will be going to increase up there, right? Yes, there will be the increase up of it, right? Now if I'm talking about it, what will be the, there will be the features of it. Please remember, there is a difficulty in, difficulty in far vision. There is a difficulty in the far vision. There is a difficulty in the far vision. What about the near vision? Of course, there is a normal near vision. There is a normal near vision, guys. In the patient of your myopia, it has clearly, he can read up the all the things from the nearby. But what about the far vision? The far vision will be going to affected in this condition. So what should be now the treatment part of it? Of course, we can give up, we can do the surgery. We'll talk about in the later part. We can give in the refractive error of the treatments, we can give the eyeglasses, we can give the contact lenses, or we can do the surgeries over it, right? So in this condition, we can give the eyeglasses, we can give the contact lenses, we can give the surgery, we can prescribe the surgeries also. But if I'm talking about the glasses, so which glasses will we give? We'll give, going to give the concave, concave type of the lenses, which is your minus lenses, which is your minus lenses in the spherical form. In the spherical form. So we're going to prescribe here in this patient for the concave minus spherical lenses. Concave minus spherical lenses should be prescribed in this patient, right? And the patient will be going to relieve by this. The patient will be going to relieve by this. Okay, right? Okay, yes, we're going to give the concave type of the glasses or the minus lenses. Yes, minus lenses. Why we are giving the minus lenses? Because the patient is having the more eye power. The patient is having the 68, 69 or maybe 65 diopter of the eye power. So we are trying to decrease it to the normal. So we're going to prescribe the minus lenses. As we give the minus lenses, the patient will be getting this. Is it clear? Very good. Now moving forward. Now we are moving forward for the next one. There is a type of myopia is also given. There is a three type of myopia is given. The first one, the same, we talked about it, axial. The second one is the curvatural, and the third one, which is your pathological. Right? So we have the axial, we have the curvatural, we have the pathological. Starting with the axial myopia, what is the scene in the axial myopia, guys? Please remember, there is an increasing in axial length, right? So what can be happen? If the normal axial length is what? Normal axial length is 24 mm. If it is more than that, then what will be happen? Just I'm drawing a simple diagram again, that this is the your eye and it is having the this rays will be going to meet up in the normally on the focus point of the retina. If your axial length of eye is increased, so I'm drawing with this black color. If your eye length is increased, so of course it will remain just before the retina. Yes, it will be remain where? It will remain the before the retina, and this will be going to cause your myopia, right? So this type of myopia will be going to known as your axial myopia. Yes, so this type of is myopia is known as your axial myopia. So please remember which type of axial. Yes, in the axial myopia, there will be the increasing in the axial length. The same thing in the curvatural myopia, we talked about it. There will be, of course, here also increasing in the corneal curvature. We talked about it in the curvature increasing. We talked about it, guys. We talked about in the keratoconus. Let me know in the keratoconus what we had. In the keratoconus, we are seeing the increasing in the curvature of the cornea. What we saw the increasing in the curvature of the what we saw. Yes, we saw the increasing in the curvature of the cornea. So when the curvature of the cornea, when your curvature of the cornea will be going to increase up there, so because of increasing this curvature, because increasing in this curvature, there will be the there will be the increasing in the refractive power, and of course due to this curvature will be going to increase. Yes, there will be the like normal curvature is like that, but if it is increasing more, you can see it is increased more, the curvature increase more, it will be going to cause your curvatural myopia. Yes, it will be cause your curvatural myopia. So axial myopia, curvatural myopia. The last one, which is a pathological degenerative myopia. In this condition, what we can see, there will be the degeneration of, there is a degenerative changes on the macular region, or maybe any tumor, tumor inside eye, which is your intraocular tumor. Yes, inside the eye, which is your intraocular tumor. Yes, this is the intraocular tumor. Yes, this will be going to seen in your intraocular tumor, right? Very good. Now, should we move forward? Yes. Let's talk about it. Let's talk about it. We have the special type of, we have the here, we have to talk about the especially about the, we have to talk about the specially type of your Your pathological. So this is there will be the pathology will be seen there. But what about the axial and the curvature? Of course, if the curvature will be going to increase, this is the curvatural. If there is a curvature, if your axial length will be going to increase, this is your axial myopia, right? So now, is it clear to about you?